Are you looking for a safe breast screening option that uses no radiation, no compression, no body contact, involves no pain, and is FDA approved? Do you live in Utah or Southern Nevada? Thermography is an effective breast cancer screening tool for women ages 22 to 92. It can detect the abnormal physiology of breast cancer years earlier than mammography can detect a tumor. Thermography uses thermal imaging and avoids the harmful effects of radiation and compression. Thermography can detect the abnormal physiology of breast cancer years earlier than mammography can detect a tumor. Thermography uses thermal imaging and avoids the harmful effects of radiation and compression. We use a medical-grade thermal imaging camera to take 5 images of the breast. These 5 views allow the specially trained medical doctor to screen the entire breast. The findings are not restricted to just the tissue that can be compressed for mammography. Using thermography for breast screening provides a totally safe and non-invasive method of detecting changes in the breast that can result in the earliest possible detection of breast disease. Thermography can detect and record physiological changes at any stage in the development of a tumor, beginning in the first year through to when a tumor has established and is dense enough to be seen with mammography. This early indication can lead to earlier diagnosis and better treatment options. This thermographic image indicates a local infection after a biopsy. This 37-year-old patient presented for routine thermographic breast screening. She was not in a high-risk category and had no family history. The vascular asymmetry in the upper left breast and the local hypothermia at 11 o'clock was particularly suspicious, and subsequent clinical investigation indicated a palpable mass at the position indicated. A biopsy was performed and a DCIS of 2 centimeters was diagnosed. The results of this routine study led to the diagnosis of inflammatory carcinoma in the right breast. There were no clinical indications at this stage. Thermography can show significant indicators several months before any of the clinical signs of inflammatory breast disease, such as skin discoloration, swelling, and pain. Inflammatory breast disease cannot be detected by mammography and is most commonly seen in younger women. Early detection provides the best hope of survival. Thermography can show suspicious findings that are outside the range of mammography. This tumor was missed by a mammogram as it was just outside the border of the medial left breast. Every individual's breast patterns are unique, just like a fingerprint. No two are the same. Once a stable baseline thermogram has been established, annual screening can detect any changes that justify additional testing, which can lead to early diagnosis and better outcome. The very significant vascular activity in the left breast justified clinical correlation and close monitoring, which returned an opinion of fibrocystic changes taking place. These changes can be monitored thermographically at regular intervals until a stable baseline is established and is reliable enough for annual comparison. The increased vascular activity in both breasts is consistent with the hormonal changes in pregnancy. This patient was unaware that she was 4 weeks pregnant at the time of her scan. To learn more about thermography or to schedule an appointment, go online to therm.me or call 877-871-9051. Current screening locations in St. George, Utah, Provo, Utah, and Las Vegas, Nevada